Hello, this is Barbara Conniff, Client Experience Director, and I'm here to talk to you about how the client care coordinators enter the cancellation information and the rescheduling information in Central Reach so clinic directors, client care coordinators, anyone else of interest can get a good report out of Central Reach to see what's going on with cancellation and rescheduling activity. So for more about that piece, how to get a good report, please see my companion video about using Central Reach to look at cancellations. So anyway, what I'm going to be talking about today is this tool developed by Ruth Lonero, IT project manager, amazing, who is going to who helped us develop reason codes that the CCCs can put into Central Reach when canceling appointments for rescheduling. So I'm going to give a public service announcement for the CCCs. Please do have all your cancellations and reschedules in your clinics. Go through them so that your reason codes are clearly and accurately used, and follow-ups for rescheduling are promptly covered. So I'm going to share my screen here in a sec and just review this document so you can see what these contents provide for how the report comes to be because of the data we're putting in it. So basically we have four kinds of categories. We look at client cancellations, provider cancellations, we look at provider changes, and then other. So client cancellation happens if we are unable to fill it. We categorize it as a client cancellation. And then there are various reason codes that we have been using for about 3 months in some of our clinics, and they seem to be working well. We've done a little tweaking. They continue to work well. Health issue, time off, weather, medical appointment, non-medical appointment, life schedule change, unplanned event, no-show, exit, unknown. We also have provider cancellation, and this is when the BT, the provider, initiates the cancellation. We can't reschedule or find a substitute, and this is an unfilled appointment. Similar items that are listed in here, a couple of differences. School activity is for those BTs who have finals or other things that they, can't work today. Maybe there are some items of human resources note, bereavement, jury duty, military duty, Family Medical Leave Act, and human resources wants to find that information via Central Reach. Then we have this provider change. So what does that mean and what is it for? In Central Reach, when you look at cancellations, you can use the provider change to say, okay, what appointments were made up? So if the client or the BT makes the cancel, and you're able to put in a substitute or a makeup appointment with same BT, you really do want to capture that as a provider change, because you can look at how many hours does that give you back? How many hours have we recovered? When we look at our cancellation hours, it tells us a number. When we look at how many hours we are able to reschedule, it tells us a number. And both of these numbers impact our weekly therapy delivery data. So we want to make sure we're categorizing that, knowing how we're doing. So anyway, our reason would be substitute if the provider cancels, yet we're able to bring in another BT to cover for that client's appointment. The provider makeup, okay, the provider canceled, yet we can reschedule that appointment. Then client makeup. Okay, the client cancels, but we can reschedule the client's appointment with same or substitute provider. And then separation and exit, able to put in somebody to get those hours, even though the provider may be leaving. So we're able to still try to continue therapy. Then we have the other category, and the other category we hope to use sparingly. It's basically about services on hold. If a senior canceled an appointment because it's a team meeting, a clinic meeting out of town, nothing that the provider could influence. If there was an exit and services are being faded out, incrementally reducing time. Did a family request someone to leave a team? Did we accidentally double book? And was there a training offering? So these are the cancellation reasons that we are using so that we can produce clean and readable and actionable reports. And then also just know that when I send this document out, this gives some additional information that I'm also including when I do my how do you find things out in Central Reach when you want to look at cancellation activity. This same document has some supporting instructions from Ruth. So we are here to help you with our cancellation and reschedule process, and we hope you find the information that we are able to put into Central Reach useful and easy to get out of Central Reach so that we can all change lives by helping our clients and our BTs achieve their desired therapy hours. Thank you and have a great day.